ICU and situations in the ICU, and how it relates. I'm Specialist Schaub.
Specialist Platt. And we actually got to work with a TBI patient for the past couple days on the floor. A little bit about her. She's a 40-year-old female, had fell off a ladder, like 8-foot ladder while painting, and husband doesn't know how long she was out there. Just came out and saw her on the floor, and she came into Madigan. She had a hematoma, and they did a
Craniotomy. She had a hematoma and two different types of hemorrhages, but we'll get into it. We'll wait to that example.
And so we've been watching the patients, but next slide. No? How's that?
There you go. So, internal learning objectives, giving the appropriate instruction and lecture. At the conclusion of this presentation, you guys, our clinical group, will be able to articulate proper and educated understanding and recognition of a traumatic brain injury in the ICU.
ELOs, the student will understand and recognize definition, etiology, pathophysiology, AMP, and how it is affected, incidents, signs and symptoms, diagnostic tests and results, treatments, including medications, procedures, and nursing applications.
So, the definition of a traumatic brain injury. Traumatic brain injury, or TBI, is an insult to the brain from an external mechanical force. Non-degenerative, it's non-degenerative, and non-congenital, which means it doesn't get inherited and it doesn't happen over time. It happens because of a mechanism of injury. So the healthcare community cannot agree on one solid definition. From all the definitions that we researched, I wasn't able to find one single solidary thing that says this is exactly how it's defined. So puts the patient at risk for temporary and permanent impairment of cognitive, physical, and psychosocial functions, and we'll get into that a bit later. It's also known as brain injury, head injury, and you can see it caused by blunt force penetrating, blast, smoke inhalation, O2 suffocation, hemorrhages, brain tumors, and infections. Actually, just real quick on the infections part, I actually saw in the news, I want to say it was in Chicago or it was Seattle, the two cities that actually pay attention to the news. A teenager actually died of bacterial meningitis. Ooh. So that was kind of somewhat correlating to this. Anyway, I digress.
Sometimes.
There's a picture of a duck and a skull.
What?
To break up the monotony of the slides.
Oh yeah, thank you. No, please.
So affected anatomy. Of course, you'll be looking at the scalp, which is the protection of your skull. Cranial and facial bones. The periosteum and the fibrous membrane that covers the bones there, and that's very vascular, and that's where you see most of your hemorrhage from. Then your cranial vault, your cerebrum, which is your motor and sensory functions. So when you're doing your neural assessments, you can kind of take a look and see what part of the brain is being affected when you do that. Your cerebellum, which is your balance and muscle control or muscle tone, your posture. And then your brain stem, which does more motor control, and then works with your sleep cycles and regulates your heart rate, BP, respirations, and so those are all the things that you're also going to have to monitor with your patients, and just make sure you're doing them every hour or every 4 hours, and it'll give you a good idea of how the patient's doing, whether they're doing some sort of recovery, even if they're in a coma, or if they're getting worse, and you can call the docs for other interventions.
So real quick to add on to that, when you think about brainstem and like reticular activating systems, you need to think of autonomic functions when it comes to brain functions, such as regulating heart rate and respirations, which is a large reason why TBI patients are intubated to secure that airway in case that autonomic function of respiration fails.
Concussions.
So it says, look on the bright side. For one brief, glorious moment, you forgot you were on the Cubs. So the anatomy and physiology, the affected systems. So what we're covering, meningeal layers. They cover the brain and the spinal cord. Comprised of the dura mater, arachnoid matter, and pia mater. The dura mater is the least penetrable meninge. and the CSF circulates the brain and spinal cord through the meningeal layers. The brain tissue is made of neurons and glial cells. It's important to remember that glial cells are present in brain tissue because those play a large role in pretty much everything in the brain from what we found through our research. Neurons transmit sensory and motor impulses back and forth from the peripheral and central nervous systems. The glial cells support the neurons, and there are 5 different brain cells classified as neuroprotective. And that's where Platt had to stop me because I wanted to get into all the different cells and how they protect it.
You need some regulation.
And you have the tentorium, which is really seen as the tentorial notch. It's a triangular opening of the dura mater. Brainstem, blood vessels, and nerves. It's a pathway pretty much for everything from inside your skull down to the rest of your body, and it passes through your foramen magnum, which, if you guys remember, is pretty much the circle at the base of your skull. When you have infratentorial, is your cerebellum and brainstem below the notch. So we'll get into this a little bit later because we're going to talk about infratentorial and supratentorial herniations too. But just remember, infratentorial is the cerebellum and brainstem below the notch, and supratentorial is above the notch. Okay. So there's actually the